Let's go back to a patient that's undergoing chemo radiation. And we talked about how important it is for them to get the proper nutrition. A lot of times in that situation, they don't want to eat. They can't eat. They
Good
don't
point.
feel like eating.
Good point.
What can be done in that
Let's look at
situation?
why should nutrition be included in any cancer patient's comprehensive care. Number one, 40% or more of cancer patients actually die of malnutrition. And you just mentioned one of the reasons is, chemotherapy. First of all, they're depressed because they got this diagnosis of cancer. Maybe things aren't looking too good. Then they're given chemotherapy, which further removes appetite, causes nausea. And then oftentimes chemo changes the body's ability to digest and absorb the food. Now you got, if you went from marginal malnutrition, now you got serious malnutrition. In my book, Beating Cancer with Nutrition, I talk about, among other things, this Dragon Slayer shake, and I have found many patients have given me feedback. They said it's very helpful. Basically taking some fruit and vegetable, puree it in a high-speed blender, add a tablespoon or two